Hi, and thanks for joining me for Monument Health's Insurance 101, Advantages and Disadvantages of Medicare Plans. My name is Heather. I'm a Population Health Coordinator with Monument Health. And today I want to talk to you about the advantages and disadvantages of traditional Medicare, Medicare Advantage, and Medigap plans. The plans we're going to talk about today are traditional Medicare, Medigap, and Medicare Advantage only. Traditional Medicare includes hospital coverage, Medicare Part A, and outpatient and primary care coverage, Part B. It allows beneficiaries to go to any doctor or hospital that accepts Medicare anywhere in the United States. Medicare will pay its share of the charge for each service it covers. You pay the rest unless you have additional insurance that covers those costs. Medigap is sold by private insurance companies and is an additional optional way to help pay some of those healthcare costs not covered by traditional Medicare. And finally, Medicare Advantage or Medicare Part C is a privately run alternative to traditional Medicare. Medicare Advantage plans are sold by Medicare-approved private insurance companies and must cover the same healthcare services as traditional Medicare. As we go through these, remember there may be some exceptions to the advantages and the disadvantages that we talk about. We're going to walk through some of the advantages and disadvantages for each of these plan types, so let's go ahead and start with traditional Medicare. Remember, this plan is both hospital, Part A, and outpatient, Part B, and allows beneficiaries to go to any provider that accepts Medicare. Disadvantages are that there is no cap or out-of-pocket maximum on coverage. This means that as long as you continue to receive care, you'll continue to have bills that you're responsible for, regardless of how much you've already spent. There's also no prescription drug coverage for the medications that you take at home, with an exception for a limited coverage of medications that are provided in a provider's office. It also only covers about 80% of your care needs. This means that you will be responsible for the remaining 20% of costs, or you'll need to utilize a secondary form of insurance. This means that you may have several plans in order to offset the remaining costs, such as Medicaid or Medigap. And finally, traditional Medicare is medical only, meaning there's no vision, hearing, or dental coverage, or other perks that you might have heard about with other plans. Now, the advantages to consider are that traditional Medicare includes 99% of providers in the United States, meaning you have a very broad and open network of providers that you can see anywhere in the United States. There are no surprises to what you'll be paying for care. Each year, you have a set premium, coinsurance, and deductible with no additional fees or denials that you aren't expecting. And finally, traditional Medicare does not require referrals and has a very rare need for approval for services. As long as the insurance considers the care medically necessary, it will be covered. Next up is Medigap. Remember, Medigap is sold by private insurance companies and is an additional optional way to help pay some of the healthcare costs that are not covered by traditional Medicare. There are a few disadvantages to these plans to remember. First, the plans have additional monthly premiums that you will be responsible for. This means you will need to budget accordingly. And just like with traditional Medicare, there may not be prescription drug coverage under this plan unless you purchase a Medigap with Part D plan. Finally, these plans can have some difficulties with the timing on enrollment. Generally, it's best to enroll in a Medigap plan when you sign up for Medicare. If you wait until after the initial enrollment period, you could be denied or have higher costs based on your care needs. The advantages to selecting a Medigap plan need to be considered as well. They have national coverage, but also have coverage for care outside of the United States. And these plans tend to have easier to understand and plan for medical costs compared to Advantage plans. They typically cover the remaining 20% of costs not covered by traditional Medicare. They are guaranteed renewable regardless of your health as long as you're enrolled in the plan, so you don't have to worry about losing coverage as your health changes. And then the last thing to mention are that these plans also usually have robust chronic illness care. Medicare Advantage plans are the final option that we'll discuss. Medicare Advantage, or Medicare Part C, is a privately run alternative to traditional Medicare. Medicare Advantage plans are sold by Medicare-approved private insurance companies and must cover the same healthcare services as traditional Medicare. Think of Medicare Advantage as a kind of one-stop shopping choice that combines various parts of Medicare and any supplemental coverage from Medigap into one plan. The disadvantages you must consider with Medicare Advantage are first that you'll have monthly premiums that you will need to budget for that may be more than with other plan options. Also, you must use a provider in the network. These networks are usually very limited and state specific, meaning no national coverage and more difficulty finding providers. You may have unexpected costs or surprise fees when services are denied or not covered. This usually happens when you think a service might be covered, but gets denied for a myriad of reasons. This can make managing your costs more difficult. And these plans almost always require referrals and prior authorization for all care. Now, the advantages to these plans are that they function like a commercial plan does, meaning there are out of pocket maximums or caps to what you would pay for care in a plan year. Most of these plans also include Part D coverage, meaning you don't have to think about a separate part. And they may have extra benefits such as vision, dental, and hearing coverage that the other plans don't have. They also may entice you with bonuses such as food vouchers and gym memberships to purchase their plans. These plans also have similar coverage to traditional Medicare as required by law. Knowing what each plan includes or does not include will help in making the decision on what to select easier. This grid will help you see what the benefits belong to each plan so that you can make a decision based on those benefits that are the most important to you. Remember that traditional Medicare isn't just one policy, while Medicare Advantage is an all-in-one policy. With traditional Medicare, you may want separate drug, vision, dental, and supplemental coverage. Traditional Medicare allows you to use almost any doctor in the United States, while Medicare Advantage has a limited network. Medicare Advantage premiums may be lower, but other costs will differ from traditional Medicare. And while both must provide the same type of care, Medicare Advantage may cover more services than what traditional Medicare does in terms of more elective procedures. But these plans may also be more restrictive or have more barriers to accessing services due to their restrictive regulations. Knowing the differences between the plans, you can start to make a decision on which plan is best for you. Do you know what medications you need to have covered and what those costs might be like? Talk to your doctor and pharmacist to understand what your medication cost and what alternatives you may need to transition to are. Do you know if your care team is covered by your plan? Checking with the plan and providers to make sure they are covered under your chosen plan, or see if you'll need to transition your care somewhere else. Do you have a lot of travel in mind or have dual state residency? If so, you'll want to make sure that you keep this in mind when making plan decisions. And finally, do you have a budget for care in mind or have strong preferences for any possible perks? Keeping these in mind will help you in making a decision on plans as well. With these thoughts in mind, you can begin to make the decision on what plan is best for your unique needs. If you have further questions or need support in making the best decision for you, you can also outreach to the State Health Insurance Assistant Plan, or SHIP. SHIP is an unbiased resource that offers free services and will help you find the right plan for your needs. They're not agents or brokers and do not get paid for their services. I do want to thank you so much for taking some time to watch this video. For all Medicare questions, we do suggest reaching out to SHIP. If you have other healthcare questions, you can reach us by phone or email, or even have many of your questions answered on our website or through our other videos. And don't forget to make it a great day.